A warm welcome to this webinar, Designing a Scientific Panel on AMR, Lessons from Climate Change Policy. As the room is continuing to fill up, I will briefly introduce myself, the topic of today, and the organizers. And this webinar is organized by the Global Strategy Lab. And the Global Strategy Lab is hosting an AMR policy accelerator, a group that provides evidence-informed advisory services to governments, international organizations, and to civil society organizations. Over the last years, the Policy Accelerator has engaged in several crucial important processes on governance on AMR, invested work in shaping global unified targets, and has engaged in dialogue on the establishment of the evidence panel that we will discuss today. And my name is Anna Sjöblom, and I'm the Director of REACT Europe, and I have the honor to moderate today's session. And for those who don't know REACT already, we are a global network with regional centers in Africa, Asia Pacific, Latin America, and Europe. And as part of our mission to enable collective action that ensures sustainable and equitable access to effective antibiotics for all, we have engaged in discussions on policy development on global, regional, and national level on how best to achieve effective transparent governance and accountability in the area of fighting antibiotic resistance, and also to reflect on these systems and the setups and how they would function in reality in the countries where we are present. And the forming of an evidence and scientific panel is, of course, an important component here. But we'll go back a little bit in time. Already in 2019, the United Nations Interagency Coordination Group for Antimicrobial Resistance called for 3 bodies to support the global efforts to address AMR. 2 of these have already been created. That's the Global Leaders Group, the GLG, to drive political action on, and the other one is AMR Multi-Stakeholder Partnership Platform, the MSPP, to foster cooperation among diverse AMR stakeholders across the One Health sector. However, the third body, an independent panel on evidence for action against AMR, IPEA, has not yet been established. So this webinar is taking place in a crucial time. Today, we're 2 weeks before the high-level meeting on AMR, and the final version of the political declaration on AMR for the high-level meeting was submitted to the President of the General Assembly's office by the co-conveners Malta and Barbados on Monday this week. So it's now made official. It contains important commitment on the establishment of an independent panel for evidence. And we'll, of course, come back to these commitments and the way forward during the webinar. But it's not the first time in history a scientific panel to support decision-making in decision makers and taking necessary measures is created. In 1988, the World Meteorological Organization and the United Nations Environmental Programme set up the Intergovernmental Panel on Climate Change, mainly known to us as the IPCC, to provide policymakers with regular scientific assessment on climate change, of its implication and potential risk, future risk, as well as to put forward adaptation and mitigation options. So for this webinar, we have a Q&A function in the chat that you're welcome to use, and we are very much looking forward to questions or statements. And there's a Zoom button in the Q&A that you can use. And we want to include as many questions as possible, and this will happen towards the end of the webinar. But first, I will introduce you to the panelists that we're very honored to have here today. First out is Dr. Viviana Munoz-Tellez, who is the Program Coordinator of the Health, Intellectual Property and Biodiversity Program at the South Center. And South Center is an intergovernmental think tank of 55 developing countries. As of 2006, Dr. Munoz leads the team providing policy-oriented research, expert advice, and technical assistance activities to developing countries and runs various projects on AMR. Our second panelist today is Professor Yoba Sokona. Professor Yoba Sokona has over 40 years of experience addressing energy, environment, and sustainable development in Africa. He's been at the heart of numerous national continental initiatives. He was the vice chair of the IPCC sixth assessment report after serving as co-chair of the IPCC Working Group 3 for the fifth assessment report, following being a lead author since 1990. Professor Sukona is also an honorary professor at University College London and member of the World Academy of Sciences, the African Academy of Sciences, and the International Council of Science. Our third panelist today is Dr. Poirier. He's the co-director of the Global Strategy Lab and the scientific director of the AMR Policy Accelerator. And he's also the managing director of the WHO Collaborating Center on the Global Governance on AMR. He's also working at York's Research Chair and is the chair of the Global Health Equity and an assistant professor of social epidemiology at the School of Global Health at York University. So warm welcome to the panelists. And we will start with you, Mathieu. I'll leave the floor for you to set the scene and give us a background on IPEA and what we could learn from the work on climate change. So over to you.
Wonderful. Well, thank you so much for the kind introduction. I will share some slides. Please let me know if this works.
We can see your slide, Mathieu.
Okay, wonderful. Thank you for the opportunity to start off this amazing webinar. Really happy to be pleased to be joined by such amazing co-panelists. My name is Mathieu Poirier, and I'm the scientific director for the AMR Policy Accelerator. We've put quite a lot of thought into how we might design a scientific panel to generate evidence for AMR. And this is some early thinking that we've put out in the form of a policy brief, but really curious to hear how this conversation is going to go from this starting point. So like was said in the introduction, there we go. There have been three major bodies that were called for by the UN Interagency Coordination Group in 2019. The Global Leaders Group has been created. The AMR Multi-Stakeholder Partnership Platform has been created, but an independent panel to generate evidence for AMR has not. And there's a few reasons why we believe we might need this kind of body. The first is that there are significant gaps in the AMR evidence base. And at the same time, there's an overwhelming volume of new AMR evidence. Now, those two might seem like they're contradictory statements, but actually, there's quite a lot of evidence that's being often created in the clinical space, in certain policy interventions, but without synthesizing all of it together, it's hard to see where the gaps are. So I think we're missing some significant opportunities to generate tailored evidence, the appropriate evidence, the evidence we need to create equitable policies, because we're not seeing the forest for the trees. We're hyper-focused on certain areas. And because of that, we're also not able to identify policy options that will work to address AMR around the world. And of course, we know that's not going to be a one-size-fits-all approach. This is very much context dependent, depending on country situation and the different drivers of AMR in different contexts. So this is the context as we see it. And we have been looking into the IPCC to see what we might learn from what has been, I would say, a major success story in a model that we might follow for creating an independent panel for AMR. And of course, nothing is perfect, so there's always opportunities to improve, and very curious to hear what the co-panelists think about those opportunities. But we see four major things that we've drawn from looking into the IPCC. First, that there needs to be legitimacy and credibility that is associated with the panel. And to do that, we need to inclusively engage member states, AMR stakeholders, and really importantly, ensure that there's equitable representation of low and middle income country perspectives built into the panel design. This very much needs to be part of how it's built from the beginning. There needs to be also a recognition of scientific independence. So we need to create a network of researchers that are operating free from influence of whether it's political or commercial in nature, that the evidence they generate or synthesize is not perceived to be influenced unduly. And we also need rapid evidence synthesis. So this is something that we have heard is possibly something that can be improved now that we have new tools like AI-driven living evidence syntheses to address evidence gaps, that there needs to be timely evidence to address policy questions without waiting 2 to 3 years before we're actually able to mobilize that evidence. And possibly a less bureaucratic process where we're able to leverage existing research and evidence networks without recreating these networks from scratch, really tapping into things that are working well already. And in terms of the mandate, we see 3 major components. The first is to synthesize and arbitrate evidence across One Health sectors. So really clearly saying from the get-go that this is a One Health issue. We need to be looking at human, animal, environmental, agricultural, all wrapped up into one. We also need to center equity in research and also in how we identify policy options. So for example, recognizing that access issues are central to AMR and measuring global progress in guaranteeing access to essential antimicrobials, as well as identifying policies to address those problems. And finally, reporting on progress towards achieving unifying goals and country-specific targets that will need an independent panel to monitor and evaluate progress towards meeting those goals. So we have put some early thoughts also into how this might fit into the global governance space and how it might be designed to actually synthesize evidence and disseminate it to the people who need to see it. And we've put together this diagram, which has 2 idealized models. These are not completely fleshed out to the degree that they'd be able to be implemented as is, but 2 general models that we might look to. So the first is a fully independent model that would be initially funded by a coalition of committed countries and non-state funders that would gain credibility through a board of governors that's composed of high-level AMR leaders and scientific experts. They would synthesize evidence through an independent network of AMR experts, including, for example, WHO, FAO, and WOA collaborating centers or Cochrane collaborating centers. And there would be an editorial expert panel that would be charged with overseeing and coordinating research and developing specific policy recommendations. A board of governors would then select members of an editorial expert panel and disseminate the reports directly to policymakers, to civil society, and the public. Now, this has some advantages and disadvantages. The first is that there would be more of a perception of independence in how the policy options are developed. And there's also no need to wait for widespread political agreement to get started. As long as funding is on the table, then work can begin right away. However, there are some real risks because without government coordination or a legal mandate, this model could fail to secure long-term dedicated funding and also could produce recommendations that are not relevant to the needs of UN member states. And at the end of the day, that could lead to a failure to raise AMR's political profile because we know one of the major issues right now is that we're not reaching heads of state. We're not reaching ministries of finance. We are stuck in our silos and we're not able to advance the issue to the degree that we should. The other model is the intergovernmental approach. So this would be more similar to the IPCC, where member states would fund an independent panel directly. They would select an expert panel and working groups to adjudicate the evidence base and establish a secretariat to provide strategic direction for the independent panel. Working groups and support units would provide assessments of scientific literature and policy options. An expert panel would conduct horizon scanning to identify needs for the future and synthesize those policy options. And the Secretariat would also provide support for expert panels and liaise directly with the quadripartite, with member states and other stakeholders. So again, some advantages and disadvantages with this model. It does ensure financial and political support in that it would need a clear legal mandate to get started. It would also foster country ownership and coherence between the recommendations and the priorities of member states. The risk, though, is that this can't really get started without the political buy-in to begin with. We need to have, possibly through the upcoming high-level meeting or beyond, member states to agree on what the design and mandate would be to actually get this model started. And I want to really emphasize that we see the real contribution of an independent panel as it being a global public good that benefits member states around the world. It would produce cost-effective evidence synthesis in that not every country would need to conduct the same research over and over again. We'd be able to learn from certain contexts and apply those lessons in others. And similar to the WHO's essential medicines list, if you have a centralized synthesis function, everyone benefits and not everyone needs to pay. It would also identify evidence-based interventions to address health inequities. So I mentioned earlier that access to antimicrobials right now is in many ways a bigger problem than conservation in the immediate sense, because more people are dying from lack of access than are dying from resistant infections. And so actually quantifying the scale of need of the problem and identifying policy solutions that might address those inequities, that is a role that the independent panel can serve. We also can encourage international collaboration to facilitate AMR policymaking. So we saw from the IPCC that there is a level of collaboration that's fostered among the scientific community, among policymakers, among the Secretariat. Just the function of bringing people together is valuable in and of itself. It also enhances public awareness of AMR and informs civil society advocacy. Whenever there is an IPCC report that goes out, there's high-level political attention, media attention, and that can be leveraged to, again, scale up the level of understanding and political will that goes into solving these big global challenges. And finally, it can legitimize AMR goals and related targets in that a goal is only as good as it is measured and that we can say how close we are to meeting them. And you need a neutral arbiter to say, are we meeting global goals? Are countries meeting their commitments? And a scientific panel is needed to do that and legitimize those commitments that we're making to each other. And I think the last slide I have on here is now we actually have final text that will be considered at the upcoming UNGA high-level meeting. And point number 30 is to invite the quadripartite organizations to establish an independent panel for evidence in 2025. They say that it will it will facilitate the generation and use of multi-sectoral scientific evidence to support member states. It's going to use existing resources, avoid duplication after an open and transparent consultation with member states on its composition, mandate, scope, and deliverables. And we hope that at the accelerator, we can help to inform that process, support it as it goes on. And again, I'm really looking forward to the discussion that will follow. So I will stop there.
Thank you so much, Mathieu, for that very clear and comprehensive overview, and both like addressing the different mandates that have been discussed and the design of it, and also thinking about how to measure results and goals and where we're heading. So now I'd like to invite Viviana to share some reflections. I mean, you have followed not only the work on global level with AMR between the last high-level meeting and this one, but also like more broadly global health agenda. What is your take on and the South States' take on the evidence panel? What do you think is the it contribute in the best way to global governance? And also, if you want to share some reflection on the different design models that Mathieu presented, you warmly welcome to do so. Over to you, Viviana.
Thanks, Anna, and thanks, Matthew, for giving us the big picture for what we'll be discussing. So South Center has been involved in this discussion for the establishment of an independent panel on AMR since the idea came from the Intergovernmental Working Group, the IACG, which forwarded its report in 2019 to the UN Secretary General. And therefore, we also participated in the consultation process that started in 2020, where it's interesting to note already there was a substantial round of discussion based on one whole terms of reference proposed and the analysis of potential, I think about 11 models of how this could work. So there's significant discussion that has already taken place to help us advance on this. So a broad first impression of what's been achieved so far, as Matthew has just read, of that the draft declaration of the high-level meeting, which we hope the UN General Assembly will adopt later this year, would provide already for the quite tripartite agencies. So as most of you know, that's WHO, FAO, WOA, and UNEP, to together find the right process for the establishment. And that means consultations with member states. So in that process, I mean, the South Center view is, first of all, that the idea behind this is to make available more scientific information that is relevant to inform policymaking. So clearly that is a general objective that we support. We need to foster more communication between scientists to openly share the results of the research and do that in a transparent way so that we can have others and have peer review and comments on these. It will help establish a platform for collaboration and even networking for scientists, hopefully with a wide geographical representation. And so we have more and more work being done from scientists also in developing countries. And this would also be an incentive for them to have a place to share their work and their findings and find this network. It'll be important then to this platform will help also to have more fertilization across disciplines, which is necessary for the complex, systemic complexity of the AMR challenge. And I think in time, the panel can help to guide international developments in terms of guidance and norm setting, as well as at national and local level in how do we prioritize interventions, as well as how do we understand potential trade-offs between different interventions and what are some co-benefits of some of these interventions. Now, I would like to state that we should, of course, understand that establishing a scientific panel is, and learning from what we'll hear, I hope, from my very esteemed ex-colleague, Yuba Sogona, that as we saw with IPCC, this was a process built over time. From 1988 experience to where we are in 2024 with IPCC, this was progressive. So I think we should also allow to experiment with this scientific panel on AMR. And even if we don't, get it all perfectly correct at the beginning, that we understand that this should be a process to be built. On AMR, there are some important differences in terms of the challenge, I think, where we are in understanding the challenge of climate change. So I'd just like to highlight that I think that on AMR, collecting the existing science or understanding what we have in terms of the science base on AMR is just as important as understanding the knowledge gaps that we have on AMR. So I think the panel should look at those both issues in terms of collecting what is the science base, but also understanding better the knowledge gaps. And I think that already we have, some work being done on the One Health research agenda on AMR that identifies some of those gaps. At this point, the other point I'd like to mention is that I think some important questions will need to be clarified as we move towards the consultation process. So I think some of these will increase, first of all, to clarify what's the intended contribution of the panel. So I would suggest two key points there. One is increasing the awareness linked to increasing action on AMR, because there has been, as you mentioned, Matthew, significant progress in building on the science in AMR, but we need more broad sharing and dissemination. And hopefully this can help better inform policy and action, which of course will not take, a single one model approach, but it will be really, guided by the local specific context. Secondly, we need a better understanding of that human, animal, and plant and food system and environment interfaces for drivers of AMR and to identify gaps of what is not known. So we need that additional collaboration among the sectors and this sharing of evidence and information. So this evidence can also help guide the implementation and development of the international guidance and standards, where specifically there are areas where there are different approaches. So we know member states are not necessarily all following in that same approach. An example is when risk analysis is necessary or not to determine policy decisions, for example, on phasing out use of antimicrobials in animals or in plants, with that differentiation of veterinary medical use of antimicrobials as opposed to antimicrobials for growth promotion. The second, I think, question that arises is also the need for clarity on the specific objective of the panel. So does the panel collect and synthesize available science and data? So mainly relying on what's existing scientific literature. Does it do an review of these published literature and evidence? Or will the panel also carry out assessments based on other resources as well? So one could expect that the panel at its beginning at least should not be undertaking, let's say, additional research itself, but should be helping and compile and then at a second stage assess what is the scientific evidence. Now, will the panel provide recommendations, or at what point will that be done, as well as that objective of informing policies or making recommendations? Those are not straight for countries. Those would be also for the quadripartite agencies themselves. So how would that process work also in the design of the panel? As we know, the request is for the agencies themselves to set up the panel. The original idea was that this would be at the level of the UNGA through the Secretary General. But here we have the process back with the agencies. So definitely their involvement will be really important, so that there is that trust and buy-in to the process, but also an independence from the panel itself and how it works, and how it relates to those intergovernmental agencies. So I won't want to take too much more time at this point, so I'll just summarize by saying there's a need to define clearly the objectives of the panel, the design, the governance, including the issues of the neutrality, independence, and who participates, who the panel is accountable to, the broad geographical representation, and of course, the funding. So I hope we'll discuss those later. Thank you.
Thank you so much, Viviana. And I think what you mentioned there on the specific objectives and the scope and what lies within this mandate, we hope to come back to that soon. But I want now to welcome Yuba to join the discussion. And you have an extensive experience and been part of all the journey of building up the IPCC. So I'm sure this conversation triggers perhaps also flashbacks from the past, as well as some thoughts on for us to take in consideration for the future. But maybe you can summarize first, in your work with the IPCC, what did you see as the benefits for member states with having this reliable evidence for policymaking?
Okay, thank you. Thank you for inviting me to join this important conversation and to highlight some of the experience of IPCC that may inspire. I am setting a panel, but it's quite different from the climate. But one have to understand the role of IPCC. IPCC role is to assess on a comprehensive, objective, and transparent basis the scientific, the technical, and socioeconomic information relevant to understanding the scientific basis of risk of human-induced climate change, its potential impact, and option for adaptation and mitigation. IPCC is not conducting research. IPCC is not making any recommendation. is provide information for policymakers. This is very important to understand. It's also important to understand the context in which IPCC has been established and what has been done so far. And back to the 1990s, IPCC has been established in 1988. Back to the 1990s, there were limited scientific literature for better understanding the climate. And then so that IPCC started and then to indicate that we are facing the climate problem, but with limited evidence. And then by the year from 1990, throughout the different reports in recently indicate clearly there is a lot of evidence that humans have induced the climate and then climate change issue. There is no discussion about it. And this is very important to understand. It's also important to understand that each of the IPCC report have informed the policy making at the global level. The first report led to the establishment of the UNFCCC, the United Nations Framework on Climate Change Convention. And then the different report, the last report have also influenced the Paris Agreement. Each of the IPCC report and then have influence the policy at different level, the understanding also at the regional level, at the national level. I remember back to 1992, the African government were skeptical about climate issues. They said that this is not an issue for Africa, it's an issue for the North. And actually, the head of the state and government in Africa has established what they call the Committee of Head of State and Government on climate change. And then we have seen also almost all the head of the state in Paris. And so that the situation has changed, and that related to the work that IPCCs have done. IPCC also have influenced and stimulated the production of knowledge. And then the scope of the assessment of IPCC also have been widened more and more throughout the different years. I remember when I joined IPCC back to the 1990s, and I was wondering myself what I'm doing in this pattern, because the issue they are discussing, they are addressing is quite distant from what the issue I'm concerned with. That was in the IPCC first assessment report or second. The focus was on economics and climate science, where I was interested on development issues, on poverty aspect. That was completely absent. When I discussed with my colleagues, and then they said, look, we are not producing, we are not conducting research, but we are assessing literature. If you want us to assess those different issues to bring on board, you have to produce literature on those different issues. We, some of the authors coming from the South, we get together and we make some publication on the well-known, journals, climate policy and other, on issue of development, on issue of equity, on issues of justice, and then that broaden the scope of the work of the IPCC. And so that it stimulates also the production of knowledge. And I think that those are some of the lessons and then some of the aspects. And then stimulate supporting the policy, informing the policy, supporting the different, the providing input to negotiations, but not interfering on the negotiation process. At the same time, stimulating and then the production of knowledge on issues, on the gaps, on the knowledge throughout the different years, and then those are the role of IPCC. But we may discuss later on, there is no more problem also related to the IPCC, such as the issue of, inclusivity, the issue also of bringing on board, different part of the world, and then all those different aspects, we may discuss that later on. Let me stop from here.
Thank you so much for that overview of both like the journey that has been taken on with also creating new knowledge in field that was not on the agenda only 10 years ago today. And I think that resonates a lot with where we are also in the AMR community when it comes to there are some blank areas where there's a lacking knowledge, and a panel could play a role there. I'd like you to, before we wrap up today, to give us just 3 advice as an AMR community on like things we need to think of in going ahead. But I'll switch over to Mathieu and to Viviana just to hear your thoughts on the current text in the declaration. Mathieu, you included in your presentation. It has writings on how the process will look after the high-level meeting and the consultative process there. But it's also a little bit tells us it could be interpreted like there's a wish for a panel that is also involved in creating research. And as was mentioned by Professor Sugona before, that is not what the IPCC has done. And is there now, if you read also some of the considerations from member states, some of the hesitations from some member states on the panel, are we needing to leaning towards a panel that would be less of a creating policy option, but more lean to creating evidence? Or what is your reading on that political landscape at the moment?
Yeah, thanks. So maybe I have 2 big reflections. First, so interesting to hear Professor Sakona's experience in the climate space, that there was a time when countries of the global south looked to these issues and said, well, are these really our issues? And I think research has a role in bringing the value of action in these different spaces to the fore. So by that, I mean, if you looked at the state of literature 5-10 years ago in AMR, then you very fairly may have concluded that this is a high-income country problem, because that was where all of the research was being produced, and that's where the scale of the problem was being measured. More recently, and I'd say most high-profile example, was the Institute for Health Metrics and Evaluation ran a global burden of disease of AMR study that, through their modeling predictions, established that the scale of the problem is worse in low and middle income countries, particularly in sub-Saharan Africa and South Asia. And before we had those numbers, it was hard to say, where is this an issue? And now we can say it is an equity issue, that taking action on AMR will promote equity. And the second part I'd like to highlight is that there are opportunities for promoting equity through research that could be generated by an independent panel. So I often point to the example of U equals U in HIV/AIDS space, where undetectable equals untransmittable, and establishing the scientific evidence that was the case helped to make the economic case for investing in treatments, that if you could treat people living with HIV effectively, that would reduce transmission. I think we can do the same thing with access to antimicrobials. If we establish the scale of problem of access and its ultimate impact on AMR, that can be one effective way of laying the groundwork for civil society to advocate for greater equity and access to antimicrobials. So I'll stop there.
Okay, over to you, Viviana. And perhaps you can just share some of the concerns that countries may have on scientific panels like IPEA and IPCC, just briefly, and then we'll soon get to the questions in the chat.
Thanks, Anna. I think in addition to what countries might be thinking, it's just as important concerns that there might be of, either other relevant stakeholders in this process, as we definitely want everyone to be involved. So I think the broad issue of inclusivity is important across the board. So both in terms of geographical representation, also openness. So that process of design of how to select who can participate will be really important. The issue of conflict of interest, in particular financial interests of those involved, as well as potential influence from vested interests in different themes that might be addressed. In terms of the follow-up to the decision that's being taken, I think we have to work with the text of the decision. So key point being really trying to get agreement on the objective. So what's the objective and the gap that the panel should seek to fill from this starting point, and noting that, this can be a process, it can be elaborated in time. There could be, let's say, a 2-3 year review process and see how it goes. The importance to just get it up and running, and hopefully by the 2025 deadline as it's established. So the consultation process really needs to be done right, and we have already that lessons from 2020. So I think hearing what countries have to say in that consultation process, but also other stakeholders is really key, and not overshoot the goal of the panel. The issue of trust, again, is really important because this really requires buy-in, since the idea is to build on the scientific evidence that then helps to inform, the right interventions and policymaking. So that trust in what's being done by the panel is important. Otherwise, it just might not be given such attention. So I think those are related concerns that might be addressed by others. And I would just highlight as a last point the issue of how much resources doing or setting up this panel and its implementation may take vis-a-vis other areas. We know that the AMR field, there's a increasing understanding of the problem, and a big gap is really the financial means available, in particular to developing countries, to be able to take the wide range of interventions. Even when they're costing their national action plans, they don't have sufficient funding for this. So the declaration, the draft declaration for the high-level meeting, would mentions that there would be a goal to up to $100 million US dollars for fully financing some national action plans in AMR. And if you see a single country national action plan, might be close to half of that amount. So definitely the finance is slim. So a concern is how to address this issue of saying, how do we ensure that money that may go into the panel is not in any way taking away from the necessary mobilization of finance towards actual implementation of national action plans according to country priorities.
Thank you so much, Viviana. And Yuba, do you have any reflections on this, like on the process moving forward from the actual declaration, decisions, and things to take into consideration, given that this is a process that takes time and that we really strive for being inclusive?
I think that Viviana and Mathieu indicated some of the dilemma on this very important aspect, because where the knowledge is produced is in the north. If we take the IPCC case, we recently assessed that out of in terms of research and adaptation, is only 13% of the funding on adaptation get to African issues. Out of that is only 3% that the African scientists get. And then the remaining 97% is from the North working on Africa. This is an issue, fundamental issue. And then you assess if exists, if do not exist, how you inform the policy. And that's a very important element. And then second aspect, how you stimulate the research community in the continent, because IPCC work in the voluntary basis. No one get paid. If you are from the South, particularly from the global South, you do not get paid. I worked more than 30 years in IPCC. I have not been paid. But if you are from the North, you get support from your government as a research institution. There is an equity aspect there, and a different dimension of the equity. We need to look at that. And then there is a huge gap on knowledge. And then we have tried in the African case. Next week, we'll have an event in South Africa, and then to set up an African Institute for Sustainable Energy and Climate Change issue for Africa. It will be a virtual institute. And then to produce knowledge in order to better inform the IPCC's assessment, at the same time, the policy in the region. And there is different dimension. Certain things the panel can do. There is a number of things the panel cannot. You need to have a third party who will take part on that. And then we have also to think of not having the policy too much influencing the scientific body. Because we have seen that in the more and more the policymakers are infiltrating the IPCC, influencing. And then they can also preempt what will be in the report by funding the research. And then we see more and more from the North. And then they, as the IPCC is not conducting the research, is assessing the literature. And then the North will fund number of issues pertinent that will be in the IPCC assessment. So that will increase the imbalance, the inequity aspect. And there is a lot of dimension one have to look at it. And then it's important also to think at what will be the best governance system that needed to put in place if you are having the panel. Because many are having, because on those governance is also very important. Much more important also is the inclusivity, as I indicated, between scientific disciplines, between different regions, between the younger generation and the elder generation, and then the equity dimension. There is various elements one have to learn, not precipitating and create something that will create more problem than solving the problem. And then those are some of the elements I just want to bring to the discussion, as the time is very limited.
Thank you so much for this very important intervention, and also like flag for us how both like geopolitical and financial forces are threatening equity and also evidence-based action. So I think this is a really important lesson for all of us to take home after this webinar. We have one a question in the chat that is actually linking into what Viviana mentioned, and several others also today. It's from Kim 4 in Guard P. And her question is, what role the panel would play in keeping countries accountable to meeting the targets and supporting those who are struggling to achieve the targets? So will the panel be able to keep countries accountable to meet the targets set and support in correcting those struggling to achieve these targets? Anyone who would like to give a short answer on this one, or we can take all the three of you with some aspect. But maybe, Viviana, you want to develop a little bit what you started off before.
No, I think that we can't attribute, at least not at this very early stage and not knowing what kind of resources and design the panel will have, such an objective. So the issue of accountability for action by governments is, it's a multi-stakeholder responsibility, which I think a panel itself, particularly a scientific panel, its role should be more to provide evidence of where the interventions should be made, but not really to evaluate the interventions that governments have done, especially if they're policy oriented. That would seem that would be more relevant for other kind of work that's being done. So I think that while accountability is really an essential issue, for that issue, I think one of the most important issues to push for is increased transparency in terms of what governments are doing in terms of policy actions, and also sharing information, including, for example, specifically on whether it's what they're submitting to the glass system, whether they're submitting to WOA in terms of antimicrobial use, consumption, those elements of increasing transparency. We know what is happening exactly in terms of antimicrobial use and consumption would really help then we can get all the stakeholders to do their own role towards increased accountability.
Mathieu or Yuba, you want to add on to this?
Maybe I can just quickly add that I know at one point there was text being debated that may have put forward an accountability mechanisms for policies implemented at the country level. That's no longer under debate, and I really don't think that's where there's the best value here. It's much more in terms of how we achieve progress globally. So there is still a possibility that there will be a unifying goal of a 10% reduction in AMR attributable deaths, measuring that kind of thing globally, where you're not placing blame on any given country, but you're seeing where there's opportunity for more progress. I think that could have a real cohesive function, and a panel could contribute in that way.
Okay, and Yuba, over to you. And also, if there's something that you haven't covered yet, because we're soon approaching the end. please feel free to.
I think that one have to make the distinction between policy at the global level, different level, and then the science. And then to have a fair world, and then to have the scientific integrity of the panel that will be in place with no influence of anyone. Because IPCC is based on the scientists in a voluntary basis, just one element. And then the funding also is a voluntary basis on the funding. And then we had some difficulties in certain period to have resources, and hopefully, and then IPCC attracted resources that allowed, to have a kind of inclusivity, because if you are from the South, your participation in the research on the IPCC activities is supported by IPCC, not your own government. And this is very important. But more and more, as I indicated, it will be very, in the, that was some of my frustration in IPCC, because you cannot continue to have 7 years of assessment actually, where we are facing some urgency. And I indicated, and this is one of the reasons also I left IPCC. And I said that more and more, we have to have a targeted research on a number of issues. This is one element. And a second element also is that in the panel, I have the sentiment that the panel should not be represented by government. You are not representing your government. It should have been represented by scientific disciplines. Different disciplines you came on the panel, just not UNFCCC. And on the Secretariat for Negotiation of the government. But in the IPCC, you are not representing government. You should have to represent the scientific disciplines, and then to make sure that, and then we have a comprehensive understanding of the issues, and then we also have more information in order to inform policies at the different levels, from the local, national, the regional, and the global level, and then to support also action in the ground. And then those are very important. But more and more, because of the influence of IPCC, and then we have seen more negotiators coming from the UNFCCC and then taking part in IPCC. And then so that more and more, it's becoming much more political than scientific. And I think that those are some of the things you need to have that in mind. How you maintain the scientific integrity of what you are doing, and then how to make sure also that the policy will not dictate what the science should do. And then to make sure also that, as I indicated, that to preempt what will be on the assessment. Because as you are assessing the literature, and then you can preempt what will be in the assessment by funding number of research on a number of issues. Let us take one element on the modeling. On the modeling side, IPCC Working Group 3 is highly dominated by integrated assessment modelers. And then they think a longer term period, by 2100, go to any African country asking him, and then to think about 2050 or 2100. And then this is for him, does not exist. The long term will be 5 to 10 years. And then if you look at even the agenda is set, you are in the North agenda, because it's based on the infrastructure based in the North that has been created, and the lifetime will be by the end of this century. And then so that those are some of the issues one have to be sensitive on that, and then to make sure the integrity of those who will be leading the scientific process is not questionable. We can discuss, but time is really an issue. Sorry to be long.
Thank you so much. I think this is very good to have as our last part of the panel today. So I think we have gotten so much out of this hour. I would have loved to continue another hour, and I think this is a topic that we can come back to, because creating to have an effective response against antibiotic resistance, AMR, is using scientific evidence, sound, and create policy on the base to that. And that needs to be done on a daily basis, regardless of a panel, and also in a day-to-day lives. They think the principles that have been underlined also during this hour on scientific independence, transparency, integrity are so important. I also thought it was very good that the resources aspects came through in this talk. So we'll soon round up. We know that there's 2 weeks to go before the high-level meeting, but that a lot of work is just starting there. So like you said, Juba, it's about running because we're facing a crisis, but it's also about thinking and taking a stepwise approach in designing this way forward in the best possible way. I would just take the opportunity to highlight some of the other things that will happen in the coming weeks, because actually we from REACT has a great collaboration with several other civil society organizations and communities with a call to action that I hope will be posted now in the chat by Julia, where we actually are collecting, we have up to almost 200 different communities and civil society asking, requesting an action on AMR now, but also on engagement of civil society and communities. And many of these groups are based in the Global South and have not had the possibility to even register or go to the high-level meeting. So we in New York on the 24th are trying to group as many of these voices together at an event that also will be posted information about. We haven't sorted out the streaming details yet, but we've invited also a lot of speakers that are not present in New York for this event. So please go and sign this call to action, and also follow the registration link for the event, and keep your eyes open also if you're for the future steps there. I also want to remind you that Global Strategy Lab has produced a good policy brief on the topic that Mathieu mentioned also in his presentation. That is available on the site of Global Strategy Lab. And there's an evaluation form after the webinar. I think the team of organizers and also myself, we're very happy to hear input of your thoughts, as well as ideas on future webinars and different kinds of input. So there's a couple of links in the chat that you can follow. And I'm just going to see that I have not missed any of these information points. Want to thank the panel for being part of the program today, and want to thank every one of you who has contributed also in the chat with exchanges and information. I think we'll can follow up on those afterwards also. And please keep tuned for more webinars and activities coming up. Thank you so much for joining today.